Hello everyone. So today I'm going to share some knowledge about how to use this a very important tool which is freely available for all learners. That is Notebook LM from Google ecosystem. So it's a Google app ecosystem which is an AI integrated, mainly used for a research assistant as a personal tutor in your learning curve. It could be used for a common pediatricians or a common doctor. It can be used for a researcher or any academician or any education or a student. So this is a versatile tool which is available in Google ecosystem. So I have some contextual slides regarding this notebook LM. I have around 15 minutes contextual slide presentation. Afterwards, we have around 8 to 10 minutes, 3 or 4 modules, how effectively we can use this Notebook LM in demonstration, the real use case demonstration. So we move on to share screening. So Notebook LM for the doctors, mainly as a research assistant or a personal tutor or a teacher. It's a micro-learning module. So I'm a advisor for this certification course of Artificial Intelligence in Medicine by Dr. CA and advisor to the Indian College of Artificial Intelligence in Medicine. So we move on to the next slide. So what is exactly this notebook LM? So why it is matters for the doctors? So as I told you, it's a very freely available, grounded clinical research assistant, unlike other ChatGPT or Gemini or Perplexity or Claude. It's a ground truth source grounded from where we can get the data or the materials and we can develop some studio like material like a video podcast, audio podcast, or a slide deck, various things that you are going to see. So today's module map will be one, how to get these sources, from where should be this knowledge base should come from, and how to make a chat with these grounded sources. You may have 10 sources, you may have 20 sources, in whichever the form the data it has come, how to chat with this effectively and how to prepare your notes. Then after making a notes from these grounded sources, then you are going to give an output in the form of studio. It could be a audio podcast, if it is a video podcast or a slide deck or an infographic and various forms. So we have a very three important sections in notebook: the sources, the chat, and the studio. Okay, then the final wrap up will be there. So in module one, we are going to see how we can bring the ground sources which you have in your computer or in a website or in some other sources like videos. So all those things you can upload into this notebook LM. Okay, in the form of PDF, in the form of PDF slides, or in the form of website URLs or links, YouTube links, and audio files. So these are all the various forms you can upload the grounded sources to the notebook LM that we are going to show you. Okay. For example, if you are in Indian Academy of Pediatrics, you can download all this PDF from the Indian Academy of website. Then you can put add into the in the form of PDF into the notebook LM. Then you can chat with these PDFs with various your questions through the prompts. Then you can make your own notes. Then you can use it the studio. So here comes the quality or the quantity because you have your own resources in the various forms, the form of peer-reviewed journals or anything. From there, you are extracting the data. So you are building your own knowledge base in module one. So in first module, what you are going to do, demo walkthrough, we are going to show you the ad sources, upload the guidelines in the form of any WHO or IAP or PubMed URL. You can paste this PubMed URL or YouTube lecture URL. You can copy it and you can generate a summary over all these things. The notebook LM will a good summary. On top of summary, you are going to make your own notes because that summary may not be the sufficient. The tip is you have to curate this all these grounded resources and put a qualitative report as in the form of notes. And from that saved notes from all this PDF, you are going to make a studio output. So whichever the form you like it. So in module 2, so once we are uploaded all our grounded sources in the form of PDF, videos, audio file, or a URLs, everything will be in the source section and the summary will be extracted. So you have to have a good chat with the summary to find out whichever the best you want from this grounded truth to the output. So this is this intermittent part of this notebook LM, what I call it as a heart of notebook LM. Here you have to spend a lot of time to make a good amount of a desired output notes in this chat section. So in demo section, I'm going to show you how we have to chat with this notebook LM. So we have to interrogate with the sources as a plain language. We have to check the citations which have been shown, whether the grounded source has a source citations and references, or if you have taken from the websites, you have to see that cross-check the citations, then you have to make your own notes. So what is the first line of antibiotic in neonatal sepsis? Like this charts, you have to summarize the contraindication of across the all uploaded protocol. So there won't be any fabrication or factious or hallucination in this. So there will be zero fabrication so that all your resources, what you are there, you are going to have a make a notes and you are making a output. So in the module 2, the chat best practices for the clinicians is the powerful prompts. Like compare the dose recommendation across the three papers, create a differential diagnosis tables from these case reports, explain pathophysiology of second year MBBS. So like that simple prompts you can give with a good context will give a good notes for you that you can save it and you can use it further for the studio purpose. So why it is very, very important? Because depending on your prompt, Notebook LM is going to give you the output from the your own resources that you have uploaded, from your own URLs you have uploaded. It is not taking anything from the outside your grounded resources. That you have to remember. So all these things, how it is going to work for our clinicians. It could be save the valuable answers as a notes, one click citation, make it audit ready, a perfect for teaching and manuscript writing for your research, or in your medical college teaching or you're teaching your staffs, then it is reliable bedside decision support. So these citations make every answers traceable, ideal with grounded truth. So in module 3 is a very, very important where you are going to see the magic of Notebook LM. So have a sources, you have made a chat. From the chat, you have made a notes. From the notes, you are converting notes as a next source for this studio. So now I think hopefully you got this. So in module 3 studio, all your sources which have made it into nodes through the chat, it will be turned it as a ground source for your studio. You can do audio podcast, you can do video podcast, you can do mind maps for teaching, you can do study guides, you can do brief documents, and all this frequently asked questions also you can make, like in the form of quiz, in the form of polls, all those things you can do. So here is the main demo section which comes. So these are all the steps which is very, very helpful in medical education. So we are going to generate the audio. We are going to create the mind map. We'll build the studio guide. Okay, we'll customize the audio. Depending on the language, what you can do, you can select it. So here the notebook will become very, very important tool. So then, after having a good output in the form of studio, how to share and collaborate with others for the journal clubs, for multiple author manuscript, for resident teaching cohort in a medical college or in a corporate hospital, how you can prepare for your conference using this slide deck or infographics, all those things will be covered. Okay. Module 4, final, the wraps up session. What is the take home messages, what we have learned today from this micro learning module regarding the sources, chats, studio, and share. So this will be the contextual slides. Okay. So now we go to the how to open the notebook LM. So you go to the Google, search, type notebook LM. So this page will appear. Then you click on the, so you should have a good Gmail account. Try Notebook LM. I have a Gmail account. It is opening directly. So this is the first page of Notebook LM. Here you can see various my Notebook LM previous Notebook LM that I have made. You can prepare thousands of Notebook LM. It will be in the Google server database. Whenever you want, you can retrieve it. You can rename it, you can retrieve it. So now here is a settings page. Okay, I don't think by default it will be more than sufficient. Okay, you have to create a new notebook here. Here you have to click. So this page will appear. So here we have three sections here. So one is a grounded source section in the left hand side of you. In the center you have a chat section, and in the side you have a studio section. These are the three important components of Notebook LM that you should remember. Here you are going to upload the sources by clicking here. Here you are making a chat with all these resources. Here you are making a studio. Okay. So click on the add sources. Here you are going to add the sources. You can upload the file here. You can take the URLs from the various website or YouTube. From your Google Drive, you can upload, or you can just copy the text and you put it in this prompt box. Okay. So now I'm clicking on the upload the files. So whichever the folders you have any files with you, okay, you can upload it here. So what you have, let me check what I have in my this thing. So I have a research article here, some guidelines in urinary tract infection in the download a research folder. I will click all these sources. Okay, then I'm opening. See here in the left side of you, these sources are uploading. See if you want more sources, there is an option here. See here, you can go to web, you can connect your G Drive if you have in your Google Drive. Okay, if you go to the web, you have an option fast research and deep research. So if you want to get some more data, go to the fast research, go to the fast research and click on this section. See here, you uploaded the file which has all come in the right side. You can enlarge this. So if you want to select all these things, you can select. If you want to again go through this, what you have uploaded, it will show you what sources you have uploaded. It will give a summary of that. Okay. You can minimize this. Now I have selected all the sources which have been uploaded. Now I am going to show you how to upload a URL. So go to the add sources, select the YouTube and paste any YouTube URL. How to do that? Again, I'm going back to my Gmail. I'm opening YouTube account, my YouTube account. So my YouTube page is open. I click on the search, urinary tract infection in children. Okay, I put search button. So now I got this much amount of. So there is a 1 year ago. So I find this is a good. I'll click on this.
Urinary tract infection can happen in children as well. There are many reasons for.
So how to select this URL? Go to the share button. So copy this link. Then come back to notebook. Paste the URL link that you have copied. Okay. Then hit the insert button. That URL link is going to come here. You can see here. So this is also one of the source. So now you know how to connect the URLs from the website or YouTube, how to connect with your computer to upload the sources. Okay, this is about adding sources. Okay, how much to add? There are some limitations. You cannot add complete in gigabytes. It should be in MBs, less than 300 to 500 MBs, not more than 50 sources. These are the limitation of adding the sources in notebook LM that you should remember. Okay. So all these resources, notebook LM has made a summary here. Advances in precision, pediatric UTI, management stewardship. Okay, so it is telling we have taken from 6 resources and today's date it is showing. Okay, so there is a 3 button here. You can customize your notebook according to your name or anything. That also you can do. All these things you can play around. Okay, so once you read this, you have to take little more time because in the chat box you have to do a lot of time. You have to spend. lot of time. So depending on the paper, you have to give the prompt. If you find this summary is very good, then you can save. See, click here, you can pin here, and you can save it as a note. So copied it to the clipboard. Then it is giving some follow-up question. What defines a complicated atypical? If you click here, so it is going to find out the answer from these resources. This is a follow-up question which has been by default asked by Notebook LM only. But it need not be the same question. You can put your question also in the chat box. So it is going to answer this. What defines a complicated versus atypical urinary tract infection from this source only? Okay, it is not going to web and it is not finding. So it is responding. So you know how to upload the sources, then how to start. See now it has given its thoughts regarding this question's answer in pediatric consensus guidelines. So these are all the differences, you know. You have to read each and everything this one. And you can save, you can click here in a save note. So what is the meaning of this saving this note? From this grounded sources, you have read a summary and you are making it as a notes. Where this notes will be, you can see here, it will be here. See here, it will be, once you click on the save notes, it will come in the beneath of the studio. Okay. You have initially the research as a notes, another follow-up question you have a notes. That means you have made a notes. So you can make hundreds of notes like this. Now I'm going to show you your own question regarding UTA. So ask this PDF how to investigate complicated UTA. Okay, I am putting my own question. Let's see. It will go through this all this article. If it is there in that article about these investigations, step-by-step investigation, it is going to give you. It is analyzing. So by the time it analyzes, I will show you. You have to click in this three button that your notes. Here it is asking convert to the source, convert all notes into the source, export to the documents, export to the sheet. So you can take whatever. If you do this, convert all this into notes, it will be helpful for you to make further videos. Okay, I have clicked that. So now my answer has come. Investigating a complicated UTI infection requires a systematic approach. How nicely it has been given. You have to read this. Even if you find this is a very good for your studio output, this also you can save it as a note. You can just copy it and you can copy it into your computer. Wherever you want, you can copy it. If you give a thumbs up, so it is going to ask you, okay, we'd love to know what you think. So it is factually correct, easy to understand, informative, creative, or you can type your own feedback. Okay, you can click on excellent, then you submit it. That means notebook is learning from you. This is called typically a reinforcement learning of notebook. That means you have trained a student and you're asking a good answer, good question to the student. Student is answering. And after the exam, student is asking, how is my performance? That is what the notebook LM is called. So you pat on that student, you have done very well. You have answered all the questions. You have answered the properly, precisely to all the question. That is how you motivate this notebook LM. So this is how you have to give chat. Okay. So now I have made three notes here. So I will put all these three notes into a sources. Now comes the magic. See here in the notebook LM, you have audio output, you have a slide deck, you have a videos, you have a mind map, you have reports, you have flashcards, you can make quizzes, you can make Infographics. See, all these things are the studio output. Now we will go step by step. How to make a audio output. See, in the audio output, if you click here, you can customize your audio output. It could be a deep dive where two hosts will speak. If it could be a brief where only one host is going to give a very brief note of it. Okay. It could be a critic. That means expert review of that sources. Okay. You are reading a journal. You are giving a critic report of a journal. Or you can do a debate. So these are the four components. I'm taking this brief as to show you in the demo. You can select the language also. So these are all the language which are available. I will select English because it is commonly used language. Okay. And what you should the AI host focus on this episode. That means the speaker who speaks where you should focus. Okay. So you can just type whatever the prompt you have. Here I'm not typing anything. I'm just telling to generate it. Okay. It is start generating audio output. So all these things will take time. Okay. You have to wait. By that time, to save the time, I will go to the slide deck. So slide deck means the PowerPoint presentation through these grounded sources. You can have a detailed one. You can have a presentation slide for your conference. So detailed one is mainly for a full text digital, perfect for emailing or reading by yourself like a personal learning tutor, personal tutor or personal teacher. Whereas a presenter slide is mainly for teaching purpose and for the conferences. Again, you can select the language. So length of the text you can choose whether it is a short or default or long. Okay. Again, you can give a prompt. You can add your name, your designation, each and everything you can type here. Okay, it will come. Also, you can focus on which are only for the investigation, only for the clinical management, only for the symptoms. You can give a prompt and type of audience you are facing, whether it is in a very urinary specialist, nephrologist, or neurologist specific, or a microbiologist. You have to tell the domain and you can generate it. So now I'm clicking on the generating button. Okay. Then comes the video. So in video podcast, you have cinematic type, you have a explainer type, you have a short, very short videos. Okay, you can select whichever you want depending on the output you want, video podcast. Okay, then you can tell this notebook LM the video should focus on any defining a complex infection, managing risk, treatment. So all those things. Otherwise, you can customize your own topic also by typing here. Here I am choosing define complex infection. So again, this video podcast is started. Okay. So all this thing, it is running. It will take little time. Okay, let it take time. Now comes the very, very important that I like a lot is mind map. So what is mind map? Here, whatever the sources you have uploaded, it will be make it for useful for the teaching in a form of a tree branches. Okay. So you can give a prompt whether this mind map will be restricted to specific source like a investigation or a clinical management, or you can make it generalized. Okay. It should anything you can just type here. Okay. All these things will learn by using by day-to-day practice. Okay. So now I am clicking on the mind map. This won't take much time. It will be very fast. It will be mind map. So we know about audio, slide deck, video, and mind maps. Now comes the reporting section. So report of these documents, you can make it out. You can create your own report, a brief documents, a study guide, or boost. You can edit the languages. Even you can give a prompt how the report should be. Okay, it should be in a table format, a diagrammatic format, or infographic format. All those things you can do it. Okay, by clicking this one. So here it is suggesting by looking at these documents, clinical practice protocol. Okay. So it is started doing reporting. So another feature is this flashcard. So you can customize your flashcards for the study purpose. Level of difficulty also you can select whether it's a easy or medium or hard. It could be this flashcard should be for like your small notes you have made for before your exams, before your conferences, what the stuff you should tell without forgetting. All those things you can make a flashcard, keep it with you in your mobile phone. Just before your presentation, you can just reproduce. Here also you can give your own prompt. Okay, you want in a detailed format or a specific format or number of flashcards you want. Okay, then you click on the generate button. So in studio, you must be seeing now we have audio podcast ready, other things, and mind map is ready. All these things we'll go through once we finish this studio section. So we finished all these things. Now we left with quiz and infographic. So you can make quiz for your students, okay, for your learners. So you can type how much you want, fewer, standard one, or more also. If you click on the more, it will create more. So number of quiz questions for ASCII, preparing ASCII question, MCQs for your students, you can do it. So level of difficulty also you can select easy, medium, and hard. Okay, here I'm selecting. You can give a prompt also. Okay, for what purpose you're creating this quiz for the your own exam preparation or for your own learners or courses for your own students. So you can create up to 32, maximum 50 it is allowed. Okay. So you can tell to restrict it to this urinary tract infection. Okay, it should mainly focus on whether you want to focus on a very tough question, a recent investigation, that also you can give here. Now click on the prompt button. So now this quiz is going to come. Okay, let's see the output later. Then comes the infographic. This is the commonest thing everybody is using. So once you click on this infographic arrow button, you can choose your language. You can choose the orientation of your infographic, whether it is a landscape or a portrait or a square. Okay. You can select depending on your type of your patient. These are all the varieties. I'm selecting this rocket type. Okay. And level of detail also, whether it should be a very little bit of words, a standard or detailed one. Okay. Here also you can give a prompt to this infographic, how it should be in your way of thinking. Okay. Then click on the generate button. And if you are doing a studies or anything, this is the last thing that is data table. So you can create a data table of your own studies, like how many patients you have done in the form of Excel sheet. It is going to give. You can describe your data table, how it should be. Okay, what should be the major findings in your research papers? How many columns you want? Whether you want just titles, authors, key results, methodology that you have used, and references and citation. All those things you can type it here and you can create the data table in your way. Okay. This is mainly for your data analysis, data visualization, and for your study purposes. So now we know about the sources, how to upload the sources, how to make chat with these sources, and how to save the notes and make these notes into the ground truth notes into the sources. And so these are all the outputs. Okay. So these are all the sources you have taken out from there. You have made studio. Here, let's see one by one. So this is a data table that you are going to see here. Just I'm enlarging this. See, this is giving in these tables. Okay. These are the things. This you can export from various sources. Okay. You can click here, export into the sheets into your email account. Okay. If you don't want, you can delete it and you can give once again. Or you can share with your friends. You have to give anyone with the link, copy the link and you can share. Okay. Otherwise, you can share it to the public also. Okay. You have to save this. So you know about in the studio data table. Then we come to the mind map. See here in the mind map, so this is the infographic. It's not a mind map, it's a infographic. So you can enlarge it and you can see how beautifully it has given an infographic. So this you can give it to your patients or a health education for your nurses, your ward assistants, your lab. For teaching purpose, you can use it. Okay, you can click here on the good content. That means this content is good. You are giving a feedback. Okay. See, this is how the infographic will appear. Now we have a quiz part here. See here, it has prepared the quizzes as per this guidelines. ABCD is there. I am enlarging this. Just so it has prepared 10 questions here. Okay, you can see here. And it is, if you want hint also, it will give you. So randomly I'm selecting one answer here. It is showing it is wrong. So it is giving the right answer. That is how. Then you have to click on the next. So what is the recommended time? So these are all the things. Again, I am clicking randomly. Again, I have answered the wrong. Answer is D. Okay. You can ask here, explain. It is going to give the ground truth. So this is how the quiz will appear. Hopefully you got this quiz also. Then comes the UTI flashcards. So these are all the flashcards. You can see here, it is asking, going to give you the answers. What is the mandatory first step for suspected complicated urinary tract infection, that is complicated CUTI before? The next question, it has developed 56 flashcards. This is something like a reimbursed notes. Okay, this is about the flashcard. Now we go to this section. This is a report I think we have gone through. So this is the audio podcast.
This is the brief on complicated urinary tract infections. We're seeing a huge overhaul in UTI management right now, ditching those aggressively long treatments for precision diagnostics and much shorter therapies to fight antibiotic resistance. First, we have to know what we're actually treating. A complicated UTI means high risk factors, like being a newborn or having an anatomic.
So this is the audio podcast. This also you can share with this 3 button. Okay, you can download it, you can share it, you can rename it. If you don't want, you can delete it. Okay. Then comes the this is a slide deck. Okay. PowerPoint presentation. You click here, see how beautifully it has made a PowerPoint presentation, precision to the practice, modern management of UTI. So you can just scroll through this. So this is how the PowerPoint presentation is made through Notebook LM. You can click here on the revise and you can edit this PowerPoint presentation also. You can add your name. You want to change anything, you want to put an image, you can give a prompt here. Okay. Just tell them to add some more content. Okay. Just click here, generate. It's going to generate the new slide for you. Okay. This is how we have to play around with the PowerPoint presentation. Okay. So video, it is taking little bit more time. Once everything is ready, you click on this video. Okay. And you can do. I will show you some of my previous video to save the time. I'll go back to Notebook LM. Okay. So this is my previous Notebook LM. We'll go here. So this is the video. Sorry. Yeah.
When the first heavy monsoon rains hit an Indian city, the relief is immediate. The summer heat finally breaks, and the air begins to cool. But about 2 weeks later, that relief usually fades. A child comes home from school with a headache, or a family member develops a sudden dry cough. Local clinics and hospital wards quickly become overwhelmed. They fill to capacity with vulnerable patients, especially infants and the elderly, who require.
So this is a cinematic video of this monsoon triage. That means clinical infections commonly we come across the monsoon period. So hopefully, guys, you know how to use this, how to add the sources, how to make a chat with the sources, how to save the notes, and from the notes, how to create this studio, and how to share it, how to do a collaborative work with others. All those things are the take-home messages from this notebook LM. So hope this uh, micro-learning module will help you. Thank you. I'm Dr. Deepak Chiradoni. I'm a senior consultant pediatrician. Thank you very much. So let me stop the presentation. If any Q&A, you can please ask me over the or Doctor's AI website so that I can able to answer. Thank you very much.